Good afternoon, everyone. Thank you for joining us today to discuss CMS transmittals. My name is Karen Curtis. I'm a provider outreach and education specialist here at WPS. Joining me today is Leanne Foster. Leanne's going to be helping me out by monitoring the chat for questions that you may have and also providing some additional information during the presentation. Now I have just a couple of things to cover before we get started. The Training Center webpage is where you can find information related to the Provider Outreach and Education team. You can find a link on this slide, and it's also going to be added to the chat. Now, once you're there, you can choose the live events card, which will bring you to a list of all of the webinars that we're going to be holding for the next 6 to 8 weeks. You can register for upcoming events and download copies of the presentations that we show during our webinars. Now, if you haven't gotten a copy of today's slide deck, there is still time. You can just click on the link and that will get you there quickly. The Training Center is also home to our Encore Presentations webpage. Videos are available for up to 90 days and they can be watched directly on our website. After that 90-day time period, they will be removed from the website, but they will remain on our YouTube channel until the information changes. Now later, we are going to be having a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. I did receive a couple of pre-submitted questions, which I will answer at that time. Now, if there's any questions that I don't get to, or if some maybe require additional research, then I'll send an email out to everybody in attendance and I'll get those answers provided to you. At the conclusion of today's webinar, you will be asked to provide feedback on how I did today. This is your opportunity to let me know what I did right, as well as areas where I need to improve. There's also opportunity to provide topics that you would like to see covered in future education. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the changes that you ask for. One thing, the last thing I do need to let you know is that CMS does prohibit the recording of this webinar. We are recording the event so it could be posted to our Encore presentations. So anything, if you feel like you missed something or if there's something you want to share with somebody else, there will be an opportunity to view this as an Encore. I am hoping that by the end of today's webinar, you'll know a little bit more about CMS transmittals, where to find them, and how they're handled by WPS. We're going to start out with what is a CMS transmittal. So a CMS transmittal is an official communication issued by the Centers for Medicare and Medicaid Services. It provides updates, revisions, or clarification to existing Medicare policies, procedures, or systems. Transmittals are used to convey new or changed instructions to Medicare Administrative Contractors, or MACs, regional offices, and the provider community. Transmittals can also be used to communicate updates or changes that will be made to the CMS manuals. So in short, a transmittal is a formal way of CMS to distribute operational and policy guidance to ensure Medicare rules are implemented consistently. So what are the reasons for CMS to issue a transmittal? Well, first we have policy updates. So a transmittal may announce a new covered service, and then they go on and they provide coding or billing instructions. It might update payment rates or modifiers, bundling rules for certain procedures, things like that. It may introduce a new HCPC CPT or ICD-10 code. Many of the changes that I just mentioned are going to require changes to the system. So if the transmittal introduces a new service or a new code, Then changes are going to have to be made to FIS or MCS to allow those codes to be submitted on a claim. If payment rates or bundling rules change, then updates are going to need to be made to the system so that those claims will process and pay correctly. There may be edits that are set in place that we'll need to update so that these bundling rules can bypass edits. Transmittals also play an important role in program integrity by making sure Medicare rules are applied consistently and correctly. By issuing clear, updated instructions on billing, coding, and coverage, transmittals reduce the risk of improper claims or intentional misuse. Since transmittals are distributed to all MACs, it helps provide consistency with the way claims are processed across the country. So in general, WPS should process a claim the same way Noridian or First Coast processes a claim. By keeping Medicare policies accurate, consistent, and enforceable, transmittals help protect the program from waste, fraud, and abuse. Now, lastly, we come to manual updates. We've talked about how transmittals make changes to the Medicare program. So this is going to lead to manuals having to be updated. Some of these transmittals are just going to be notifications that the manual is going to be updated. The manual section will be shown with the actual language that's going to be added, removed, or revised. These types of transmittals also serve as a record of when and why changes were made. So let's take a look and see where those transmittals are located. Now, the photo on this page is a link to the transmittal webpage, but I did want to tell you how to navigate to this page. So from the cms.gov website, you're going to click on Medicare. You'll then go to Regulations and Guidance, then Transmittals. I have that outlined there in red. Now, we're going to go out there in a few minutes, but I did want to talk a little about the structure and about our process here at WPS. So we're going to start by looking at the different sections. Now, before we go through these features, I want to say that not all transmittals look the same or have the same sections. I have chosen to take features that are commonly seen, but I just want to throw that disclaimer out there so that, if you see something and you're like, hey, I thought this was going to be in everything, it's not. There are some differences, but I tried to pick ones that were common. Transmittals are going to start with a header, and that's going to provide information such as which CMS manual the change applies to. It'll give you a transmittal number and a release date. And the majority are going to include a change request number that prompted the update. In my time here with Medicare, I've always tracked things by change request number. I've never really looked at the actual transmittal number. I've always gone by change request, but I have found transmittals that don't have that. So that was kind of a change for me. Now, the subject section provides a title or a description of what the transmittal is about and a clear focus of the update. Below the subject line is the summary of changes. And here, CMS is going to explain in plain terms what the update is doing and why. So it serves as a quick reference so that readers don't have to dig through the full manual language to understand the purpose of the change. Sometimes these transmittals can get really lengthy. There's a lot of language put into them. So this summary of the changes kind of gives you a quick synopsis of this is what's going on. The effective date is when the instructions, the policy, or the updates described in the transmittal must be applied in practice. Now, when we go out and we take a look at these transmittals, under the effective date, there's going to be a little asterisk, and that's going to read that unless otherwise specified, the effective date is the date of service. So this becomes really important when we look at effective date versus implementation date. So unless otherwise specified, that effective date is going to be the dates of service on the claim. That's what it's going to apply to. Now, the implementation date, that's going to be the deadline that's given by CMS that the MACs must have the systems, processes, or the instructions in place to carry out the change. So this ensures that moving forward, claims are processed correctly according to the new rules. This date can be the same or it can be different from the effective date. Effective and implementation dates can also be different for individual business requirements. We'll take a look later at the business requirement table, but it basically lists everything that needs to be changed for the transmittal. And there have been times where CMS has said, okay, for a business requirement 1 and 2, this is going to be the implementation date, or this is going to be the effective date. And then it will list other business requirements that could be effective or implemented months later. So that can make things a little bit difficult when you're trying to juggle the work that needs to be done to meet deadlines. It doesn't happen a lot, but I have seen it. Now, we haven't gotten very far into the transmittal, and we've already have 3 dates. Like I said, all of them can be different. So that's something that you'll really want to look at as you're going through. If you're looking at changes that are going to be made, that's something that you really want to pay attention to. Now, next, we have the changes in the manual instructions. Not all transmittals require a manual update, but here you can find if the language in the manual is going to be revised, if new information is going to be added, or if language is going to be deleted. It's also going to provide us with the chapter, the section, subsections, and the title of where the change is going to occur in the manual. Now, the background section provides the context and rationale for why the change is being issued. It typically explains the problem, the policy requirement, or the regulatory updates that led to the transmittal being issued. In situations where a transmittal is rescinded or replacing a previous one, then the background section is going to reference that older transmittal, and it's going to explain why this new one is needed. Next, we have the policy section. This is going to explain what the new or revised policy is, why it's being implemented, and what actions are required by Medicare contractors, providers, and suppliers. Its purpose is to clarify existing regulations, maybe introduce new rules, and provide guidance to ensure that Medicare policies are implemented properly. The business requirement table, from my experience, is usually the biggest part of the transmittal. This is where we're going to find the specific tasks that must be completed by various Medicare contractors in order to implement the policy changes described in the transmittal. It kind of acts as a detailed work plan. So all of the parties involved understand what their responsibilities are and the necessary system updates that need to take place. Provider education is an important section because it determines who is responsible to inform providers of the change. If CMS is going to send out some sort of communication, or is it going to be the responsibility of the contractor? I'm sorry, guys, I kind of have a frog in my throat, but so the provider education part lets us know, hey, us, CMS, we're going to tell the providers what's going on, or you guys are going to have to do it. Supporting information, this is where you're going to find additional details, recommendations, and context that wasn't covered in the preceding sections. It's kind of a catch-all for information that's relevant to the implementation of the new policy, but it doesn't really fit into the policy or the business requirements. Lastly, we have attachments. This is another important part of the transmittal because it can contain a variety of documents that provides essential supporting materials. So a lot of common examples, you could see updated manual pages, sample forms, coding lists or tables, things like that. So before we go out and we look at the CMS website, I did want to provide a little bit of a general overview of how WPS handles these transmittals. So any department at WPS has the potential of having a business requirement that they may be responsible for completing. So our CCU, or Contract Coordination Unit, is what I would describe as the gatekeeper of the whole process. Things start with them. So it comes into them, and then transmittals are looked at by all the different departments here at WPS GHA. I've listed some of the common ones, but each department is going to have to go through and they're going to have to look at the business requirements. And they're going to have to determine, okay, does this business requirement, is this the responsibility of our department? Is this something that we need to handle? Or is this something that, you know, maybe the claims department or medical review, they're going to have to handle that. We can't do anything with it. But they have to go through and they have to make sure that every single one of those business requirements, that there's somebody taking responsibility for those and making sure that they get handled by that implementation date. This is going to make a little bit more sense when we look at some of the examples, but I just wanted to walk you guys through that. And we do have to prove, you know, hey, we met these business requirements and this is how we did it. So I'm going to go back up to slide 10. And hopefully this will get us to the CMS transmittals. Leanne, can you verify real quick that the CMS transmittal webpage is showing?
Yes, we are seeing the transmittal page.
Great, thank you so much. Okay, so you can see that right here we have CMS provides the archive transmittals. If we scroll down here, it goes all the way back to the year 2000. So all of those, they provide links if you need to go back that far and look at something. But I'm going to go over here on the left and we're going to take a look at the 2025 transmittals. So when we first go into that, you're going to see that we have a search bar up here where we could filter on different topics, but we also have a variety of filters. So if you want to use those, you have different ways of kind of narrowing things down. One thing that I do like is that CMS created this provider education column. And that's going to show, like, if they created something, they're going to put a link there. It's also going to let you know when it was released and if it's ever been revised. If we look at the implementation dates, you're going to see a lot more implementation dates for the month of October and January. This is because when a transmittal requires a system update, CMS will often try to align that with a quarterly shared system release. And typically those are the first Monday of a quarter. That usually falls in the months of January, April, July, and October. January, since it marks the beginning of a calendar year, there's always going to be key updates, things like the Medicare physician fee schedule and coding updates that are effective at the beginning of the year. So a lot of times those, you'll see a lot with that January implementation date, and that's the reason, is because they need to get all those changes in at the beginning of the calendar year so they can get those claims processed correctly. October is the beginning of the federal government's fiscal year. So here you're going to see transmittals related to major payment systems. So this can include updates to the inpatient prospective payment system, the skilled nursing facility prospective payment system, things like that. I just wanted to explain why you're going to see a lot more with those October, January implementations than you would see other ones. Now, I do want to go through and look at a couple examples. I'm going to start with, like I said, I track everything by CR numbers. So if we look at this transmittal was issued on July 31st of 2025. It's set to be implemented on January 5th, 2026. So these changes are going to be installed with the January release. CMS did create an MLN article, and that was released on August 5th of this year. So if I click on the transmittal link, it's going to provide a lot of the same information from the previous page. Additional information is going to include, here we have the publication number. So that lets us know which internet-only manual will publish this information. So we have publication 100-20. So I'm just going to show you real quick. I have another tab open. So from the CMS homepage, I'm going to choose Medicare, Regulations and Guidance. And we're going to go to Manuals. Then over here for the Internet-only manuals, it said Publication 100-20. So we can see right here, those are one-time notifications. In here, I was looking at CR 14185. 14185, here it is right here. So just so if you ever want to track it back to the online manuals, you know how to do that. So we'll go back here. Under the downloads, you can see they have a link for the transmittal. And since CMS created education related to this change, they're also going to have a link to that MLN article. So first, we're going to open this transmittal. And we're going to find the key features that we talked about earlier. So the header provides us with the CMS publication that will contain the change. It has 100-20 one-time notifications. We have the transmittal number, the date of July 31st, 2025. So that's when this document was released to the public. And then we also have the change request that prompted the change, which is the CR 14185. Next, we have the subject that clearly states that the change is being made to the effective date for common working file to bypass type of bills 12X when Part A benefits are exhausted. In the summary, we get some more important details. You'll see that the changes are being made to a previous CR 13810. So this ties the two CRs together. So someone who's looking at the information could go back to that CR 13810. They could see what the initial change was. It shows that the effective date for the 13810 was April 1st, 2025, and this is changing the effective date to include claims that are processed on or before January 5th of 2025. So let's pause for a second because this kind of changes things. So earlier, when I talked about effective dates, I brought up the asterisk that says, unless otherwise specified, the effective date is the date of service. So when CR 13810 was issued, the system was looking at claims that had a date of service of April 1st, 2025 and after. Now, this change is saying we're not going to look at the date of service. We're going to look at the date the claim's processed. Another important takeaway is that right here it says that MACs are going to be able to override Common Working File Crossover Rejections C7050. So they're giving MACs the ability to manually override this edit. So that'll be another important change. So now when we get down here to the effective date, this is what I just mentioned. It says that it's for dates of service that process. So again, we're not going to look at the dates of service. We're looking at that process date. For this one in particular, the effective and the implementation dates are the same. January 5th, that's going to be the first Monday of the month, which means that most likely all of these changes are going to be included in that January quarterly release. Now, we have a disclaimer that if there are manual changes, the revision date and transmittal number only apply to the red italicized material. CMS does use red italicized fonts in their publications to indicate changes. They also use it in some of their MLN tools. You'll see that red font that lets you know that that's what the new information is. Now for changes in the manual instruction, we have an NA, which indicates that no updates are being made to any of the online manuals. I didn't mention the funding section before because it rarely changes and it really only applies to MACs. Basically, it tells the MACs that they're not going to receive any additional funding from CMS and that any work that needs to be done in order to make these changes happen should be included within operating budgets. So again, that's not going to mean anything to providers, and it doesn't change. The attachment section shows that a one-time notification is included. So as we move down, we see that this is the attachment, the one-time notification. It does duplicate some of the material that we already talked about. The background section, we had talked about this earlier. This explains why the change is needed. It provides a little bit more detail as to the specific circumstances which would allow a 1-2X claim to bypass the Common Working File edits. The transmittal does not include any new policies. So we're going to move down to the business requirement table. Now here is where MACs get our specific instructions. The table starts with the requirement number. These are really helpful in breaking down the specific instructions and the contractors responsible. The requirement column describes the action that needs to be taken, while the responsibility column shows which contractor or system must follow the requirement. For responsibilities, CMS lists the MACs, so you have Part A, Part B, or DME. When I first started working in Medicare, there were two separate contractors that process Part A and Part B claims. I worked for Mutual of Omaha, who was a Part A only MAC. And when CMS decided to combine those Part A and Part B MACs, we merged with WPS, who was a Part B only MAC. Now, DME is an additional workload, and that is handled by CGS and Noridian. We have the shared system maintainers. This is going to pertain to the contractors who maintain the system. So you'll have FIS, MCS, VMS, and CWF, which is Common Working File. Other is a general category used when instructions apply to a contractor or an entity that's not covered in one of the other columns. Someone who may sporadically have responsibilities for changes. Now, if we look at the first requirement, It has common working file marked as responsible. They are going to update the effective dates of the bypass logic that was added in the previous CR. Now, this bypass is going to allow incoming outpatient claims 1-2X to process for payment when all of the requirements are met. I do want to point out that the first requirement says shall. And if I go up here a little bit, shall denotes its mandatory requirement and should denotes it's an optional requirement. So when I worked in the systems department and I would read these requirements, if I saw the word shall in my head, I just thought must. So common working file must update. That's just the way I looked at it because it helped me with, it wasn't something that was an option, we had to do it. You can see common working file is the only person or the only contractor that does have responsibility for this change. With this 1.1, so this is kind of a sub requirement of that one. They're usually related, and that just says that common working file is responsible for that one. When we get down to this last requirement, this 0.2, we see that the Part A MAC is also marked, and they have responsibility along with common working file. So WPS is going to have a responsibility to make sure that when claims meeting the criteria listed in this transmittal, that when they come in, they are going to bypass that common working file edit C7050. This is usually completed with testing claims. So we'd enter claims like some would meet the bypass requirements, some wouldn't, and you just have to make sure that the changes that they asked for, that CMS asked for, is actually happening in the system. For the provider education, CMS is letting us know that they're going to provide education regarding this change to providers. MACs can supplement that education once the CMS newsletter has been released, but they will be responsible for the primary education that goes out. Impacted contractors, it was the only other one that was marked was the Part A MAC. So that's what shows there. Remember, the supporting information is going to provide additional details, recommendations, and context. So here, CMS suggests that contractors review common working file edits 7050 and 7070, which may be impacted. So the actual changes that were made to the system were made to 7050, but obviously there's some logic somewhere that could overlap that reason code C7070. So CMS is recommending, hey, you may want to also check this other edit just to make sure that, you know, something didn't mess up and that claims are editing incorrectly. Now, if we move down to the post implementation contract, typically you would contact your contracting officer's representative or core if there's any issues that arise during the update, once the updates are done. If you're not familiar with this term, a core is a CMS employee who acts as a primary contact person for a MAC. Now, as a provider, if you notice that there's an issue with a change that was put into place, then you're going to contact customer service and you're going to make them aware of that issue. Then we're going to investigate it as a MAC, and if an issue is found, then the MAC would be the one that would contact that core. So that wouldn't be something you would do directly, it'd be something we would do. Again, there's a section on funding, and finally, there's no additional attachments. I do want to go back because we also have this link here that shows the MLN article that CMS wrote. I've always appreciated the Medicare Learning Network because I feel that it puts a lot of the information in an easier to understand format. At the top, we see a lot of the same information that was found in the header of the transmittal. Then CMS breaks it down and it tells us exactly which providers are affected by this change. We have physicians, suppliers, hospitals, and other providers billing for hospital services. Next, they're going to tell us what action needs to be taken. So here, I would like to call your attention to the second bullet. It says MACs will have time to reprocess claims that you resubmit that they previously rejected in error. So this takes the responsibility of those corrected claims and it puts that on the provider. So if you feel that your claim is rejected in error, then it's up to you to make sure that it gets resubmitted. This is also something that you may notice in business requirements when you're looking at CRs. If a business requirement states MACs shall adjust claims that are brought to their attention, that means that you as a provider will need to let us know if you have a claim that processed incorrectly. That way it can get corrected. But sometimes there are mass adjustments done where us as a contractor will go searching for those claims. But if you see that business requirement and it says MACs shall adjust claims brought to their attention, that puts the responsibility on the provider. Now, as we move down the article, you're going to find the background information. It's going to have a link to the CMS manual that is related to these changes. So this is the Medicare Benefit Policy Manual, Chapter 6, which is hospital services covered under Part B. It's also going to give you the section if you want more information on that. The key updates give a summary of the changes that are made with the original CR 13810, as well as the updates made with the CR 14185. The more information section will provide additional resources, while the documentation history is just to track any changes. Now, I do show we have about 5 minutes left. I will show you one more example. This one I just wanted to show. Back up to the top here. This one is they were changing the frequency of no pay Medicare summary notice mailings from every 120 days to every 180 days. As you can see, a lot of people or a lot of different areas were responsible for the changes in this one. Here, they have specific business requirements where only the shared system maintainers were responsible. So this claims process between section, this would be something that's behind the scenes that the MACs couldn't do anything with. If we scroll down here, they did make each MAC responsible for a business requirement where a new zip file code or new zip codes had to be loaded. So each MAC had their own responsibility for that. There was also CMS was also given a responsibility for this transmittal, and that was to update the IOM. Now, I did have a couple other examples, but I want to be aware of your guys' time. So we'll go ahead and move on. I did have a couple pre-submitted questions that I'd like to answer very quickly before I check in with Leanne. First, I was asked, how long does a MAC have to update claims systems after transmittal guidance? MACs have until the implementation date. That is the deadline for when all of these changes that are listed in the transmittal have to be put into the system. Like I stated, a lot of them do have to do with quarterly releases, and so these changes are going to come in through FIS. The Mac is going to test those changes, and then the update's going to be installed into production that first Monday of the month. The second question I got was, what are transmittals and how often do they change? So hopefully I've answered that first part of that question, but as far as how often do they change, it's all going to depend on the topic. Some transmittals are one-time notifications. Some pertains to files that are updated quarterly, while others are updated yearly. So it's really just going to depend on the subject of the transmittals. There could be times where changes are put into place and then something happens, like a system error is discovered, and so they have to kind of go back to the drawing board and make other changes. So there's a lot of stuff that could affect those updates and how often they occurred, but unfortunately there's no just concrete answer for that. Leanne, I will check in with you real quick to see if we have received any questions through the chat.
Karen, we do not have any questions in the chat.
Okay, great. Thank you. I will move along. So after the close of today's webinar, you should receive a thank you for attending email. There are two sections I would like to draw your attention to. The first is entitled Your Opinion Matters. This is going to give you another opportunity to provide feedback if you've not already done so. The second section is titled Certificate of Achievement, and this is going to give you proof of attendance and contact hours that can be submitted to your crediting organization for continuing education units. Now, if you do not get this email, please check your junk or spam folder. You will also need to add messenger@webex.com to your safe sender list, and that'll help you avoid any issues that could happen in the future. If you joined only by phone, WebEx is unable to generate this email. So we ask that you do send an email to the education mailbox with your name and the phone number you used to join. That way a certificate can be sent to you. Now, if you do think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject so that they know that your question is related to this webinar and they will send it directly to me. Remember, if your question is claim specific, those should go to customer service. Now, when you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Leanne add a link in the chat. I really do hope that you'll take a minute to provide feedback on how I did today. The redirect looks like what you see here at the bottom. We don't have control over how this appears, so we just want you to know that it isn't spam or anything malicious. We do quickly want to let you know about some changes that we've put in place because of survey comments. We've added chapters to our YouTube that lets you jump back and forth in between sections. We added training indicators to our webinars to provide you with more information on the material that's going to be covered. And we've also started having Medicare Education Expos. It's a whole day of learning on a specific topic. Our last one was on LCDs, and then we have one coming up in October, which is going to be the life of the claim. So if that's something that interests you, you can go to our live events page and you could register for those webinars. That brings us to the end of today's presentation. On behalf of myself, Leanne, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.